Hi class, welcome to the second half of your junior year. This video is an overview and an introduction to the unit on pediatric respiratory illness. The first topic that I'm going to talk about very quickly is the Crouppen Children. And croup causes inflammation of the larynx, the trachea, the bronchi, and the bronchioles. It affects children anywhere from 3 months to 3 years. All this inflammation will lead to mucus and noisy breathing in the lungs, which you can see because the child's airways are so small that the mucus narrows the airways even more and causes more swollen tissue, which leads to their voice being very hoarse and the classic barking cough that you hear from children experiencing croup. Some croup symptoms are low-grade fever. They usually begin experiencing some upper respiratory symptoms for 1 to 3 days, which can lead to the barking cough and the hoarseness and the inspiratory stridor. Excuse me, it tends to get worse at night, and usually the child is more comfortable when they're sitting up. It is aggravated by agitation and crying. Some nursing interventions with croup are assessment of the lungs and the cough, and the use of the accessory muscles. Positioning, cool air mist humidifier is very helpful in increasing fluids. The medications that are usually given are usually epinephrine and corticosteroids. The next illness that we'll be discussing in class is the respiratory syncytial virus, or the RSV. RSV spreads easily by contact or by infected droplets of saliva or mucus. It's a common cold to the adults. The highest risk population for RSV are young children, especially babies younger than a year, and children with weakened immune systems, say if they have cancer or if they have some kind of cardiac condition. RSV is caused by an occlusion in the bronchial airways. Lumens. It can spread to the lower respiratory tract and cause bronchiolitis, which we will talk about next. Some symptoms of RSV in babies. Usually the babies don't like to eat because they have a hard time breathing. They're usually inactive or upset or very restless. They have trouble breathing and shortness of breath, and they're usually coughing yellow, green, or gray mucus. Some symptoms, some ways of preventing RSV is, again, if you're sick, it's hard to stay away from your child, but if the parent is sick, maybe to wear a mask and keep their hands clean and keep the environment around them clean, avoiding smoke and smoking around them, and staying clear of people who are sick. Some nursing interventions with RSV are, again, is giving humidified air, increasing fluids, and sometimes they do give you the ribavirin for medications. Bronchiolitis is the next respiratory disease process that we're going to talk about. It usually occurs in infants from 1 month to 2 years of age, and this causes inflammation and congestion of the smaller airways, the bronchioles, by the lungs, and bronchiolitis is almost caused by a virus, as we spoke of earlier, that RSV can cause bronchiolitis. Some symptoms of bronchiolitis are runny nose or congestion, a cough, a low-grade fever, difficulty breathing, wheezing, and an ear infection, which is very common. Also, bronchiolitis causes an inflammation of the lower respiratory tract and the alveoli, and the thick mucus. And edema causes air trapping and overinflation or enlarged alveoli, which you can see in this picture right here. And some nursing interventions for bronchiolitis, pretty similar to RSV, is you're going to assess their airway patency. You're going to look at their accessory muscles, their lungs, their cough, what they're coughing up. You're going to check on their positioning and increasing their fluid intake. And if they're old enough, you can talk to them about deep breaths. But if they're babies, obviously, we can't do that. They usually do not give antibiotics for bronchiolitis because it's usually caused by a virus, which is usually caused by RSV. They may do a chest x-ray. They may do some viral testing. But that's about all. And the next topic is bacterial pneumonia. So pneumonia occurs when the body's natural defenses allow germs to invade and multiply bacteria in the lungs. Some pathogens that cause pneumonia are strep, staph, bacillus, Klebsiella, and there's several other ones that can also cause the child to come down with pneumonia. Some symptoms are shaking or chills, bluish color of the lips and nose. You could usually, if a baby is having trouble breathing, you can notice it very quickly. Dizziness or headache, loss of appetite, fever, cough. And what happens, as you can see in this middle diagram, is fluid and pus fill the airspace containing bacterial and blood cells, and it causes inflammation of the alveolar wall. Some nursing interventions with pneumonia are oxygen therapy, suctioning, coughing into breathing if the child's old enough, hydration. They're usually treated with appropriate antimicrobials, usually ampicillin or gentamicin, or broad-spectrum antibiotics for nosocomial bacteria. The next topic is cystic fibrosis, and cystic fibrosis affects cells that produce mucus, sweat, and digestive juices, and causes these fluids to become thick and sticky. The diagnosis of cystic fibrosis is usually at a very young age. I think the common age is 6 or 7, and it's usually done by a sweat test. Cystic fibrosis becomes present when there's a defective gene related to a protein that is involved in chloride ion transports. Patients with this disease, as I've told you, develop really thick, sticky mucus, plugging that clogs the lungs and leads to obstruction. It also causes obstructions in the pancreas, and so these children are not only experiencing problems with breathing, but they're experiencing problems in their digestive symptoms. So some respiratory symptoms is persistent cough with productive thick mucus, wheezing, shortness of breath. They get frequent chest infections like pneumonia, bronchitis, and they're also experiencing digestive symptoms because their food doesn't digest. Usually these children are very small in stature. Bowel disturbances, weight loss, obstruction, constipation is very common with these children. The treatment is diet that's increasing calories and protein, pulmonary therapy, chest PT, postural drainage, breathing exercises, aerosol therapy. They're on mega antibiotics, and are usually sometimes they grow tolerance to them, and they need different antibiotics, which is really sad to see. This is just an overall picture of cystic fibrosis. Some nursing interventions are monitoring the respiratory status, of course, doing lots of guiding and teaching with the parents. Rest most of the time. These children don't like to be lying down. They like to be sitting up, at least in a semi-Fowler's position, and oxygen. And the last topic that we'll talk about is asthma, and asthma is an inflammatory disease in which the airways are sensitive to allergens. The lining of the airways becomes swollen and inflamed, and airborne allergens are usually the main cause, but this kind of shows you the cause of asthma. Asthma has lots of triggers. Some people have many different triggers than others. It can be a respiratory infection that causes it. It could be a change in the weather, stress, obesity, dust, medications. Animals, cats seem to be very common. Some other symptoms of asthma is difficulty breathing or shortness of breath, a chronic cough, they can't sleep at night, wheezing or chest pain, cough after exercise. Asthma, exercise-induced asthma is pretty common, and this just gives you a little overview of some of the other causes that can affect asthma. Some nursing interventions is just assessing their respiratory status, looking at their accessory muscles, fluids. Medications that are commonly used are bronchodilators and corticosteroids. Okay, well, this is the conclusion of my overview of the respiratory unit. I hope that you enjoyed it, and I'm looking forward to seeing you in class.